And good morning. I'm Dr. Deuk, and I'm here with one of my patients who happens to be a dentist and specializing in reconstructive surgery. He had the Deuk Laser Disc Repair done for back pain that he's had for years. You've also had surgery on your back. You had a microdiscectomy done years ago, and the microdiscectomy helped with his leg symptoms. He had sciatica and maybe some weakness and numbness. The microdiscectomy helped with that, but it didn't help with the back pain. And what did your doctor tell you about your back pain? Could they fix your back pain?
He just told me to do physical therapy.
Before I ask you how you're feeling today, I want to talk about teeth, because there's an interesting parallel between back pain and teeth. Now, there are, 32 teeth?
Yes, sir.
32 teeth in your mouth.
We hope so.
Yeah, normally. When you go to the dentist with some pain in your tooth, you don't really know which tooth is hurting you. You just know that you have pain in your mouth. This is very important because back pain is a lot like pain in the mouth or teeth pain. And the dentist has to use a combination of diagnostic imaging, we call them x-rays usually, and then they combine that with an examination where they go in and have you open your mouth and they kind of poke in different teeth and different areas to figure out where is the source of pain. Now, the most common cause of teeth pain is cavity, right?
Mostly, yes.
Yeah. So if I go to a dentist, it's most likely, just based on numbers, that my problem is a cavity. It also turns out when people come with back pain that the most common cause is a disc problem. How do you feel now that you've had the Deuk Laser Disc Repair?
So I woke up this morning. Usually when I get out of bed, there's that intense back pain and I'm going, well, that's probably about as good as today's going to be. And this morning when I got up, I looked at my wife and she was like, why are you smiling? I was like, because I don't have that pain anymore. And I also had an Achilles repair done in 22, and I had neuropathy that I thought was from the surgery. Literally coming out of surgery yesterday, I looked at my wife and actually started crying because the pain in my left foot was all but gone, literally right after surgery. And that was something I was expecting. Dr. Deuk said, yeah, we will probably fix a little bit of that, but probably not all of it. I would say 90 to 95% of that pain in that left foot is gone. And I'm not a very emotional guy, and so for that to make me emotional, my wife, it was kind of something pretty special, and so did I. So just an amazing result.
But you've also been suffering with this back and leg problem for years, and it was crippling to your life, right? I mean, it basically ruined your career.
I did. I had two practices. I had to sell both of them. By the time I would get to be where I need to be, I was too busy, and I couldn't work with that level of pain and treat the pain at the same time. So I ended up having to sell both practices. Yeah, it affected my ability to treat patients and do what I've been loving to do for the last 25 years. So I'm only 48 years old, but I feel like I'll stay at least another 20 years in me. So I think I've now got that.
You've got it. Well, congratulations on fixing your back here at Deuk Spine Institute. Is there anything you want to say to your fans out there?
I'm sure I've got a lot of colleagues out there. I unfortunately I've lost colleagues to back pain. It's very real in the field of dentistry. And so if you're out there and you're looking at this, my name and information will be out on Facebook eventually, because I'm going to tell everybody I know that it's worth coming here. It'll change your life.
Congratulations, doctor.
Thank you, my friend, doctor.
Go enjoy life, okay?
Thank you, sir.
All right.
Appreciate you guys.